if you just want to put your questions there in the chat. And then following this presentation, we will have a very, very short survey, just a couple of questions to get feedback and on how this presentation went, and if there's anything, any future topics that you may be interested in us presenting on. We would love to hear on that. So just a little bit about us. I'm Jennifer Hansen, and my co-host tonight is Chrissy Campbell, and we are both parent resource coordinators here at the Munroe-Meyer Institute. What that means, parent resource coordinators are parents of children with disabilities or special healthcare needs. And we have specialized trainings to provide the parent-to-parent support and to help families get connected to early intervention services, medical and educational systems, and different community resources. Some of us are implanted in clinics to help meet those social determinants of health, and those are those non-medical kind of wraparound holistic needs that do impact health outcomes. And we do consider ourselves community health workers with lived experience. Our program, the Family Care Enhancement Program, is a statewide program, which means wherever you're joining us from tonight, there is very likely a parent resource coordinator close to you. These are the locations with which we have parent resource coordinators. If you'd like more information about any of the coordinators in those areas, you can reach out to Chrissy or I. And here's how to get a hold of us. This is our main line. Otherwise, you can email your questions or whatever questions or anything you might have to that email address here. This is the main campus's physical location. And we also have a Facebook page for caregivers where we like to put updates, share information, different resources. So there is the link for that, and you can scan the QR code to get more information. And again, tonight we are so happy to have representatives from each of the managed care organizations here in Nebraska. We welcome them, and Gail, Tony, and Sophia, thank you for joining us. We will go ahead and kick it off with Gail. Again, if you have any questions, please just go ahead and submit those in the chat, and we will get to them.
Okay. Well, good evening, everyone. As Jennifer mentioned, my name is Gail Ross. I'm with United Healthcare. I'm with the Medicaid Growth Team. I am a community outreach representative. I have the pleasure of building relationships with our community and faith-based organizations, as well as representing all of our members in the community. Give me just a second. I'm going to share my screen. I'm going to go off so I can switch to another screen. Let's see. I'll be the one to see if everything works smoothly. Let's see here.
Well, I can tell you, you wouldn't be the first to not have things work if they don't.
Okay, what do you see on the screen?
A very large picture of me.
Okay. Now do you see my
page?
Okay, excellent. All right, excellent. Thank you for your assistance. So again, thank you for the opportunity to share. Today I'm going to be sharing about our value add member benefits. Those are those additional benefits that all three Medicaid providers, United Healthcare, Nebraska Total Care, and Molina, provide for our members. Some of them are the same, similar, and different. There are those benefits, of course, that all Medicaid members get the same across the board: inpatient, outpatient care, dental, vision, transportation to and from non-emergent medical appointments. But these are the value adds. So the first one I would like to talk about briefly is our enhanced transportation. As long as our members are traveling 10 miles from their home address and they schedule the transportation at least 3 days in advance of their travel, we can also provide them transportation to other appointments, such as WIC, prenatal, parenting classes, to church, to the grocery store. That also includes to the community center, support groups, to the pantry, and some other meetings as well. Members, all they need to do is flip their card over and call the member services number on the back, and they'll be able to let them know if that particular transportation need would qualify. Each member gets 48 one-way rides or 24 round trip. I always recommend that you schedule round trip versus will call, because the transportation provider with round trip gets a 15-minute window versus with will call, they get an hour window. So if it's a late appointment, they do have an hour to pick you up from that appointment. So just wanted to mention that as well. We provide a 90-day supply of prescriptions for both the purpose of med adherence and to ensure that our members have what they need when they need it. We offer the Quit for Life. This is a comprehensive smoking cessation program, and it offers personalized coaching. It also provides supplies, and there's support that's specifically designed to help individuals quit using tobacco. And then there's our 24-hour nurse line. This particular benefit is available 24/7. Our nurses will listen to symptoms, offer self-care advice, as well as advise our members on finding a provider, pretty much any assistance that our members need. The help, the nurse line will provide that assistance. And then we have our Healthy Rewards program. This particular benefit is to help fill those healthcare need gaps. So for our members who have not gone in and had an annual exam or had a mammogram or prostate check or taken their babies in for well child visits, this is an opportunity for them to earn healthy rewards. And what happens is when our members go in and they complete these appointments and fill that gap, as soon as we receive the claim, then we send out a debit card, and they have various dollar amounts on them. For members who have our mobile app downloaded, they're able to see on the app how much each health reward is based upon the appointment that they complete. And then we also provide our members community resource assistance. So we have care managers on our team. They assist our members with social determinants of health needs. So if they're in need of pantries, they're in need of assistance, financial assistance, or they're looking for childcare or just some additional supports, they're able to help connect them to those resources. And we use Find Help. It is something that's available to you as well. You can Google Find Help, but that is the app that we use to help to identify community resources for our members. So community baby showers. We partner with community and faith-based organizations as well as the federally qualified health centers, health departments to host community baby showers throughout Nebraska. With our community baby showers, they're not just for our members, they're open to any and everyone. If someone attends who is our member, who attends one of our partnering hosted baby showers, they have the opportunity to select one item from 5, and that consists of selecting either a car seat, a pack and play activity center, a stroller, or a month's supply of diapers, just as our way of thanking them for coming out and supporting our partner. We also partner with the other MCOs. We invite them to participate in our community baby showers by either being a partner with us or by having a table at the community baby shower, because then that gives the opportunity for individuals who do not have United Healthcare, but they may have one of the other 2 plans. It gives them the opportunity to engage with their Medicaid provider as well. And then Healthy First Steps with baby scripts. So Healthy First Steps is more of our care and case management. And both of these are voluntary, but it's where we provide education and support on the Healthy First Steps side. And then Baby Scripts is an app that our members can download for them to participate in. If they do sign up for Baby Scripts, then they're able to earn 3 rewards at the time they signed up. They get a reward once they complete, I do believe it is a prenatal appointment, they get another reward, and then when they complete their postpartum visit. They receive another reward. But it's an excellent tool, and they can sign up for both or just one of them. They do not have to participate in both to take advantage of this particular benefit. And then WellHop for Mom and Babies app. This is also an app. What it provides a virtual support group for our members. So every other week, they meet with a trained group facilitator who talks with them. They chat about different topics pertaining to expectancy, pertaining to prenatal care, taking care of their little one, postpartum care. They even touch upon talking about postpartum depression, just a variety of different topics. It gives an opportunity for moms also to provide some peer-to-peer support to one another on this particular, during this particular benefit. And then Meals for New Moms. We provide Mom's Meals. Mom's Meals is a meal delivery benefit. It's only for qualifying expecting members, pregnant moms, who indicate a risk of food insecurity or malnutrition. We must receive a clinical referral. So that clinical referral can come from their provider, or it can come from internally from our clinical team. Once a member qualifies, then the member can select to receive a week's supply of mom's meals for themselves, their spouse or partner, and for 2 children. And then they can select to receive them before they deliver or after they deliver. And it consists of 2 meals per day for 7 days. Now, if the family size is larger, then we just recommend them flip the card over, call member services. If they have a care manager or case manager that's working specifically with them, when they call in, they will automatically be transferred to that individual, and they'll be able to assist them with a larger family size. And then Text for Baby is a mobile information service benefit that we provide. Is also for our expecting members. It's provided all the way through their child's first birthday. What it does is it provides weekly, trimester appropriate, or child's age appropriate texts about the baby's development, about the pregnancy, as well as like childcare tips, etc. But the text will only be appropriate to where they're at in their pregnancy or based upon the child's age. And then I mentioned earlier that we provide care management and care coordination. I'll talk about this a little more later, but pretty much what this consists of, all of United Healthcare members have access to care management. Every member is assigned to a clinical coordinator or care navigator and is supported by a team who can quickly address the needs of our members. So care management or care coordination and care management, as I mentioned, is more so focused on assisting our members with social determinants of health needs. So if they are experiencing food insecurity, if they are unemployed and they're really wanting to get back into the workforce, or if they, are wanting to complete their GED, just different ways that we can assist them in those different areas. And then there's our mental health wellness app. We use Calm Health. We switched to that as of January 1st. It is an on-demand app that offers clinical solutions to help our members who are experiencing low to moderate stress, anxiety, or depression, to help them to be able to, what word would I want to use? To help them to be able to get the stress, the anxiety, or depression under control. So whatever their goals that they're trying to accomplish at that moment, they'll be able to successfully complete those. And then, of course, we have benefits that address more serious mental health challenges of our members. And then we also provide substance use disorder support. It is an anonymous confidential helpline. It is available not only to our members, but also to their family. For members, all they need to do, they can call into the helpline. They can speak with a licensed substance use expert. They can get information on treatment, support groups, etc. but it is a benefit that's available to all of our members through our value add. And then there's online mental health resources. With our online mental health resources, members can access educational tools that promote early awareness, detection, prevention. It provides a wealth of resources for our members. This online resource includes self-help tools, family support resources, as well as it also can provide a visit with the provider, whether that's virtually or in person. Members would just need to register through the website to take advantage of this particular benefit. And then our door and window alarm benefit. So for our members, we provide up to 6 window and door alarms per household for members who are intellectually or developmentally disabled, or for members who have dementia. And there's other health conditions that may qualify members as well, autism. Again, I just recommend that you call into member services, let them know what the health condition is, and they'll be able to let you know if the member qualifies for the door and window alarms. This benefit helps to minimize wandering, to keep our members safe at home. It also helps to keep our members in the home versus them having to transition to maybe a long-term care facility for safety reasons. And then we have our GED education. So I kind of alluded to this earlier. So we help our members age 19 and over. We help them get their GED diploma. And we do this by paying for the GED segments that they must complete. There's 4 tests. We also send them out the study guide. Once they reach out and let us know that they're interested in completing their GED, we send them out the study guide that covers all 4 segments so they can prepare for each one. And then all they need to do, and we send that out, of course, free of charge. And then as they're ready to take each test, all they need to do is call in, let us know which test they're ready to take. We will send them out the voucher. Then they would just need to schedule and go to either the facility or unless they're able to do it online to complete their test. And then once they complete all 4 successfully, we send them out a gift card to reward them for completing their GED. Back to school programming. So we don't provide back to school programming, but we support our partners who do. So we participate. When we are able to, we provide sponsorships, we provide donations. Of course, we are engaged. If it's an opportunity for us to be present, we also go and set up a table and engage all the attendees of the back to school programs. So we usually, just to give you an example, Blue Stem Health, One World, Nebraska Children's Home Society, just to mention a few, yearly have a back to school event, and we try to definitely provide support or be engaged. And then Kids Health, this is an online resource as well. So we try to make sure that our value adds can meet our families where they are. So whether that means it's a value add that they can access virtually, a value add that maybe they travel to, but we try to provide a variety to meet our families. So this particular Kids Health is a website for children and teens to learn about health and wellness. Our members and their entire family can get online answers. They can get advice and fun through videos, written and spoken articles. There's just a wealth of information, whether that's ranging from terrible twos, single parenting, the fatherhood. There's just a wealth of resources there for our families. And then Dr. Healthy Hound is our mascot. Dr. Healthy Hound was in quarantine for some time, of course, due to COVID, but we have definitely, when we partner, we try to work things out with our partner to have Dr. Healthy Hound present. Oftentimes it does require a volunteer to wear the costume, but definitely Dr. Healthy Hound can be present and engage our members and engage the community as a whole. And Dr. Healthy Hound really is focused on just teaching kiddos about health and healthy habits and fitness. Now, give me just a second because it didn't advance. Are you still seeing door and window alarms?
Yes.
Okay, let me see if I can get it to advance. Hmm. Okay, there we go. I think it just advanced. Okay, so free cell phone service. Many of you who are familiar with United Healthcare and maybe the other two MCOs as well, but United Healthcare through the Lifeline, which is a service through the federal government, used to make cell phones available free. But this benefit has changed from free cell phones to free cell phone service. So basically, this is a benefit through Assurance Wireless. It supports independence and, of course, the ability for our members to communicate with their providers. Members who qualify, and it is based upon income, but members who qualify, they'll receive an SIM card, and the SIM card comes with unlimited text, unlimited talk, and 10 gigabytes of high-speed data per month. Members can bring their own phone, or they can buy a phone for $25 when they go into Assurance. Now, this coverage may not be available in certain remote service areas, but definitely, again, this is a benefit that you just need to call in the member services and they'll let you know if the coverage is available in that particular area. Let's see if it advances again. Okay, let's see here. Okay, let me try something else. Of all times, I think my battery and my mouse is going out. Okay, there we go. So I mentioned that I would talk about care and case management a little bit later. Our care and case management, again, all of our members have access to care and case management. Again, every member is assigned to a clinical coordinator, a care navigator, and it's a team that supports our member. Our case management team, they assist our members with both their health, our care and case management team assist our members with both their health as well as their social needs, as I mentioned. Um, on this screen, you see that our approach is very much member-centered, whole person care for our members. We really focus on, working with the community partners that work with our members. As long as our members give us permission in writing to be able to do so, we can definitely be that liaison with the members' community as well as their provider and community and faith-based organizations. Okay, now it's working. The other thing that I wanted to mention, this kind of shows what I was mentioning earlier about the difference between care management and case management. The other thing I want to point out on this particular slide, if you have a client, or let's say a family member who has United Healthcare and you want to make a referral for them, whether it be for case or care management, there's an email on this slide. You can see there in the middle, and that is an underscore. So it's ne_cm@uhc.com, or you can call member services and request to speak to a care manager, but you can make a referral requesting for someone to have a care or case management because all of our members have access. And so a lot of times a member may not know who their care or case manager is. But again, all you have to do is give us a call or send an email. And that the email, that particular site is checked daily to make sure that we can respond to emails in appropriate time. We're almost done. I can get it to advance for me. All right, come on. Otherwise, I might just start talking. Okay, there we go. So our digital tools. So I mentioned earlier about our mobile app, and then there's our website. And then with Baby Scripts, I mentioned that there is a mobile app for it. Oh boy, there we go. So our website, just to give you an idea of what it looks like when you log into United Healthcare's website, we try to make it very member friendly, where the most important information is right on the first screen when you log in. a welcome to our members, the members' ID number, letting them know what plans they have, their primary care provider's names on the front, any important documents. If they are expecting, if they clicked expecting, it will let them know about all the resources and benefits that are specifically for our expecting moms. Um, as well as, with flu season, for them to be able to get a flu shot just to, and then at the top, like the toggle bar for them to be able to move through if they logged in because they wanted to check claims, they can actually see when claims are paid. They can, look to see if their provider is in network. And one thing to mention, so with providers, with all three managed care organizations, United Healthcare, Nebraska Total Care, and Molina, we have in-network providers. Not all providers are in network with all three managed care organizations. And so if you have a provider that you want to see if they're in network, you can either call member services for all three of us, or if you have the mobile app downloaded, I'm quite sure it's the same for the other two MCOs. You can go on to the app and check to see if that provider is in network. Okay. You can also, when you go to the doctor before that first appointment, you can ask them, are they in network with United Healthcare? Or if you have Nebraska Total Care or Molina, you can ask that question because oftentimes that is most important. Individuals often want to stay with the same primary care provider or a specialist that they're working with. And so you need to know if they are in network with the MCO that you have. And then this shows our mobile app. Again, pretty simple where everything's on the front. If they need it, in a different language, they can select language and it'll change there. If they needed to request another ID card, whether it's on our website or through the mobile app, you can do that as well. And then baby scripts. This just gives you a visual of the baby script. So individuals can complete assessments. They can keep track of their weight, their blood pressure. It's just a great tool and resource that's not only handy, but as long as you have access to a computer or a mobile phone, you can utilize this particular benefit. And this just gives you a visual of some of our materials as far as like our brochure, or, when our members sign up, they receive a member's handbook, a welcomes guide for our expecting moms. You see the Healthy First Steps resource. There's just a lot of market materials that we provide them and resources just to support them, to make sure, they are very knowledgeable about the benefits that are provided. And then we are on the last slide. Just a couple of things to mention. So Jeremy Sand is my direct report. I like to mention here, we like feedback. So whether good, bad, or indifferent, feel free to reach out to me directly. My number is right beneath, as well as my email address, or you can even feel free to reach out to Jeremy. Feedback helps us to improve or to, let us know that we're getting things right. So definitely don't hesitate to reach out. Sarah Hughes. Sarah Hughes is our full-time housing navigator. She works with our homeless and our members who are couch surfing to help them to find safe, affordable, accessible housing. She does not do case management, but just to provide support to our members, because oftentimes members are not homeless because they did not have a place to stay. Oftentimes there's other reasons. There may be some disability challenges. There may be money management, needs. There may be some mental health issues. And so she does provide a level of care management and case management just to help to get our members stable. So once we secure housing, then they're more likely able to stay in the housing. And so her contact information is there as well. And then Cynthia Goslin is our tribal liaison. She works with our tribal providers, our tribal community, just providing support and help to our tribal community and our providers. And so again, her contact information is there as well. All right. See if I can come back on. Give me just a second.
Okay, thank you, Gail. And while you're doing that, we did have one question come in. If somebody has United Healthcare and they are interested in the value added benefit, specifically the door and window alarms, how would they go about getting those? What would start that process?
So what would start that process is flipping the card over and calling member services. If your family has a care or case manager with United Healthcare, you can actually call them directly and let them know that you would like to take advantage of the door and window alarms. And then what they'll do is they will order those and they will send them to your home. And I'm glad you asked that question because it kind of triggered something unassociated, but kind of going back to our community baby showers. I mentioned how our members who attend one of our partnering baby showers, how they can choose one of those 5 items. None of those items are given away at the community baby shower because, like I said, there's other individuals that don't have United Healthcare at those baby showers. There's a lot of other things that are being given away, raffled off, etc. But those items, once I confirm that they truly are United Healthcare members, I also order those items. On our sign-in sheet, they identify what they would like, and then I order their item and I send it to their home as well.
Okay, wonderful. That was our lone question. So if anybody else has any questions, if you have United Healthcare and you have questions, feel free to put in the chat and we can get that on to Gail. Otherwise, I thank you, Gail, and I believe that Tony volunteered to be up next.
Yes.
Thank you.
Thank you, Gail. Oh, were you going to pull the slides up for me?
Yes, Tony, I'm doing that right
Okay.
now. One
Thank
second.
you.
Yep, of course. And you just let me know when you want me
I
to
sure will.
move ahead.
And then I'm going to go ahead and go off camera too so people can concentrate on the slides and not me. And so I can see better too. Okay, next slide. My name is Tony Webb, and I'm with Nebraska Total Care. We are one of the 3 MCOs here in Nebraska, and we cover all of Nebraska, and that goes for all 3 of us. Just a little bit about us. I'm not going to read everything to you. What we do believe in is healthcare is best delivered locally. So probably 90% of our employees are based in Nebraska. So we know the communities, we are part of the communities, and we live next to our members. And you can go to the next slide. And some of our extra added benefits that separate us from the other 2 MCOs are we do have our Healthy Rewards program also. What that is we do send out a Visa card when you go to and get certain vaccinations or primary care visits, well care visits for adults, well child visits for children, and HPV vaccines for teenagers. Those are about $10 each, and those do go on your card once the claim is received and paid. So you won't see it immediately, but you will in due time. You can check the mobile app or online to see if you got that reward. One of our fun added benefits I think that we have is community gardens. What we do is we partner with local gardens throughout Nebraska. And unfortunately, it's not in every place, but the majority, we do have a lot. A lot of community gardens are free, but we do offer up to $45 per plot per family. So that gets the family out. They're able to enjoy the weather, be out and plant either most of it are gardens or vegetables, and a lot of the community gardens that we partner with will actually teach people and show people how to cook with those vegetables. So I think that is really one of our great highlights that we do have. We do actually have Weight Watchers, and that is online, so you don't have to leave the comfort of your home to do that. Another one is Boys and Girls Clubs for the kiddos, and that is a year membership with Boys and Girls Clubs. And I know the kids love going to that. And next slide, please. This is a picture of our website, and I just kind of wanted to highlight some of the stuff that we do. Um, so if you are ever at home and you're wondering what is there to do today, you can go online and see our member events, and anybody can go to these events. They're not just for our members. We do these updates as we get them. So sometimes we may put 2 or 3 events up there at a time. The majority of them that we put are free. Some of them are trainings or parenting. So there is a really good resource to go to if you're looking for something to do for the family, or even if you just wanted to find out what was going on in your community. Another thing that we do have is our member advisory board, and we're always looking for our members to be part, to have a say in what's going on in their care and how they feel about what's happening. And so it gives our members a voice, which I believe it's one thing that we want to do is have our members advocate for themselves. And this is one way that they can do that. Next slide, please. Another thing I wanted to highlight is anybody that is interested in applying for SSI or SSDI, we do partner with Centauri. And these are for individuals that have not started the process themselves, but are maybe just in the process of thinking about it. What Centauri will do is they will help them with the actual application and even to see if they would qualify before even sending that application off. So this is actually a really good segue if you're thinking about SSI and not even maybe sure of how do I go about doing that. So that is something that I would suggest that anybody looking for that reach out and just ask. You can call our customer service and they can make sure you can get in touch with Centauri. Next slide, please. We're going to kind of touch into our care management. I have our vice president of population health, Paula Stapleton, is going to speak. This is a short video on HESPER, and it kind of gives you a little bit depth into some of what our care management team does. If you can go ahead and hit play. And Chrissy, I don't know, there's no sound on that. We can go ahead and we can skip that. We can send out the slides and it'll be in the slide.
Give me 1 second now. I'm trying to get it to go to the next
No, you're
slide.
fine.
There we go.
Okay. And I have Paula Stapleton, and she's going to talk to us about care management.
Hi, good evening, everyone. As Tony said, Paula Stapleton, I'm the Vice President of Population Health and Clinical Operations here at Nebraska Total Care. And I'm going to chat about our care and case management teams and how we support our members. And we have a lot of similarities to what Gail presented for United Healthcare. As part of our contract and our requirements as a managed care organization within the state of Nebraska, there are certain criteria and offers that we need to have in place for our members. And so that's why you see a lot of similarity across the plans. When you do get the slides and you watch that video, that's just those are the highlights of the work that we do, and being able to support our members and these videos just showcase, the work that our team does to meet the members where they are, identify the needs that they might have, and allow them to remain in the community and have the fulfillment and successes that they do. So I'm excited for you guys to see that video when you do get the slide deck. This slide here talks about the members of our team. We have a very diverse team of different professionals, clinical, non-clinical staff members who help to support our members. And you can see the visual on the right-hand side of the slide. We're always keeping the member at the center of the work that we do. And we use a lot of different resources and tools. One, to identify members who may have higher clinical needs or social drivers of health, which are those non-medical needs, and do our outreach based on the data that we receive from claims and provider referrals, member outreach. We outreach to our members to engage them in care management so that we could help them follow the path. We do person-centered training. So when we have members engaged with our care management team, we put a care plan together with that member focused on the goals that the member wants to work on. We understand that unless we are working on what the member wants to work on, we're likely not going to help them reach their goals. And so we want to be mindful of what their priorities are that they're working on. So you can see we have like I said, a variety of different team members that are there to support the members. Next slide. This one is going to dive in a little bit of the different levels of support within our team. In addition to those different job descriptions that were on the prior slide, these are the team members that are specific, doing our outreach to our members, the frontline staff. When we identify members that could benefit from care management, we're going to outreach to that member and we're going to complete a health risk screening assessment. And that assessment is going to help us understand what those members' needs are. So if they are more geared towards social drivers of health, or if they are more on the clinical side, if they're more on a behavioral or a medical focus, that's going to help align our team members to be sure that we're giving that member and supporting the member to the best of our ability. So the care coordinators are the team members that are primarily outreaching when we first learn of a member. So when we get new member reports each month from the state, that helps us identify those newer members. And we're going to outreach and again, complete that assessment. And once we've completed that assessment, then it likely is going to go to either a care navigator who can help focus more on those social drivers of health, which is going to be housing, food, financial supports that member might need. Or it could potentially go to a community resource coordinator. They're the ones that are out in the community meeting more of our members face to face. We can do location services. So if we identify a member that has some higher complex needs, but we're not able to get in touch with them, they could go out into the community and try to engage that member face to face. And also do some coaching with those members as we connect with them. As Gail had mentioned, we also do baby showers. So if you are associated with any organizations and there's a community baby shower, we would be happy to help support the efforts of that shower. We do bring different little, giveaways to the members and want to make sure that they have the information to help navigate a healthy pregnancy. And then our complex care management team is made up of nurses and licensed clinical behavioral health staff. And that's going to be those members that are maybe have more of a medical need or behavioral health need. They're in and out of the hospital. Maybe they're going to the emergency department more for those needs. And we want to be able to support them, make sure that they're getting into their primary care provider or their therapists and getting the cancer screenings or any immunizations that they might need, their primary care visits on an annual basis, whatever we can do to help move them towards a healthier lifestyle to hopefully prevent those hospital admissions and readmissions and identify other maybe opportunities if it's more of a non-emergent reason that they're going to the emergency room um, to get their care needs met. Any questions so far on the levels of support or the team members that make up our care case management department?
We don't have any questions yet.
All right, thank you. Next slide. We have a lot of different programs and teams within our group here that um, where they, are the subject matter experts per se in those areas. So as I mentioned on prior slides, we're working on those social drivers of health. Similar to Gail talking about Sarah Hughes on their housing team, we do have a housing first team where we're going out into the community, we're going out to the shelters, identifying members who need that additional support to either find housing, understand, what resources they might have to do to fill out applications. And then once they do find secure housing, we can also help connect them with maybe financial assistance to help with that rent or those utilities or furniture. So those are different things that we can do. We have a team that focuses on sickle cell transplants. We have a foster care team. More recently, starting at the end of last year, we have a juvenile youth incarceration program. So some of those members are also within our foster care, where we're helping to support members who are incarcerated as they reintegrate out into the community and helping them understand and ensuring that they have a dental home and a primary care provider and that they have those follow-up appointments scheduled, that they have the medications that they need post-release. So that's something new that we're again just starting towards the end of last year that we're supporting. We have a team that has a lot of resources available on the substance use disorder and alcohol use disorder programs and getting those members into treatment. We also do have boots on the ground going into some of the substance use disorder facilities and treatment centers where our members are at to again support them with whatever they need to discharge back out into the community successfully, whether that's housing, again, financial resources, but ensuring that they have the supports in place. We do have a suicide prevention program. We understand some of our members may not want to, talk on the phone all the time with the outreach that we do. So there is a digital care management program where they can get a lot of the information and resources through digital means on their cell phone. We have a Start Smart for Your Baby team, again, helping to support that navigation to a healthy delivery and hopefully avoiding any NICU stays if possible. Next slide. These benefits are, again, contractual. All three MCOs are going to be providing services in these areas. And our care management team can help to find dental homes, vision providers, behavioral health, physical health providers, specialists. We're always here to help if there's any need in finding a provider that might fit the member's needs more appropriately, or if there's maybe a new diagnosis that a member has and they're not sure, who's in network that might be close to them that they could go to. We can help align our members with providers that can do that. Next slide. We have a pretty detailed transition of care program. When a member goes into the hospital or goes into the emergency department, we do have a team that focuses on that outreach post-discharge. So there's a lot of information that a member might receive at discharge with their discharge instructions. And, some of that might be a little complex at that time for them to understand. So we want to make sure that they understand those discharge instructions, doing that outreach to make sure that they do have follow-up appointments with whichever providers that they need to see within the 7 days or 30 days post-discharge. And we're going to continue to follow that member for the next 30 days, just in case anything comes up with issues with their medications or they have questions about maybe home care coming out or anything that, might or could potentially put them at risk for going back into the hospital. We want to, hopefully alleviate anything that could, be a barrier for them to be able to stay home. And then ED diversion, again, sometimes people don't know where to go or the best place to go, and they go to the emergency department where maybe they could have gone to an urgent care or another provider within their community, where they could have gotten that treatment, or maybe they don't have a provider identified to provide regular treatment and they go to the emergency room for that treatment instead. So we want to help ensure the members know the appropriate times to go to the emergency room and the other providers that are there for those supports when needed. We also have a nurse advice line and a crisis line available to our members 24/7. So if there is any needs after our normal business hours, they do have access to someone that they can talk to. And then those referrals do come over to our care management team as well for follow-up if needed or identified. Next slide. We do have incentives for members who are pregnant. It's important for us to identify these members as soon as we can in their pregnancy so that we can ensure that they, one, are getting the prenatal care that they need, and then also to, give them the educational resources to, maintain that healthy pregnancy and set them up for success for a healthy delivery. So in order to get those notice of pregnancy assessments completed, we do have incentives that we give our members to complete those assessments if we get one in at least 60 days before the baby is due. And they can have a choice of a car seat, a stroller, pack and play, or home delivered meals. And those can come at any point during the pregnancy if they want them before or after. That can be arranged through our care management team. Next slide. We have a lot of online resources. Tony had an example of our website and the resources and how to access the website. We also have a Find a Provider tool. So if you're looking for a provider within a certain zip code, there's a resource on the website where you can find that. We have the member portal that members can log into to get information on the providers, the claims, and such that might be associated with them. There is a mobile app. We have a resource of library educational resources that members can tap into, maybe smoking cessation or different disease process, so like cardiac or diabetes, and someone might be looking for, appropriate nutrition. There's different resources that can be printed out from that CRAMES library. We have Teledoc, which is a behavioral health support online that members can receive. And while I'm talking about that, I don't think it's on any of the slides. We do have telehealth available through behavioral health as well. We can connect to providers that have that availability. If someone doesn't want to go in person and telehealth works better, we can arrange for those services as well. We have a platform called Find Help, which I believe all three MCOs now use. And it's a lot of resources tied to pretty much anything you can imagine in there. And you can type in what you're looking for, your zip code, and anybody can access that, whether you're a member, a non-member. It also has access to a social needs assessment where it can help identify resources that are needed for members. And if you are a Nebraska Total Care member when you're in there, that can you can choose to have a referral over to our case management team to help with any resources needed through that Find Help app. Any one, there might be another slide, I think, maybe with contact information. Yep. And so member services phone number is on there, nurse advice line phone number is on there, our website, nebraskatotalcare.com, and Tony is a contact, and you can pretty much outreach to anybody, and we're very integrated at Nebraska Total Care. And if you talk to any of your persons that you're connected with, maybe through your provider offices, they can get referrals over to us as well. We have a lot of resources available to our members, and we're always happy to help and support however we can. Any questions?
We don't have any questions in the
All
chat right now.
right.
So just to remind everyone, if you have any questions, please put them in the chat and our presenters will answer them. Otherwise, thank you,
Yeah.
Tony and Paula.
Thank you.
Thank you.
Yeah. We will hand it over to Sophia.
Perfect. Let me share here. Okay. See. Mhm. Do you see the slides?
Yes.
Perfect. Awesome. Well, my name is Sophia Quintero. I am one of the growth and community engagement specialists for Molina Healthcare. There's four of us total, and we kind of cover different parts of the state. I mainly focus in like the Omaha metro area and Sarpy counties areas, and sometimes up north as well. Um, we'll go over some general information. Um, so we'll provide just a little overview of Molina Healthcare here in Nebraska, a bit of our mission, our values, and how we support our members in the communities across the state. We'll start off here with this is Frank Klepper. He's our plant president and CEO. He's very passionate about all the stuff that we do, and I can personally vouch for the fact that he's always, when he can, he'll be at outreach events. I think I've lost count of the amount of times he's come out to support outreach events and has come to be a part of them as well. So we are very mission driven here at Molina. We serve individuals who need quality healthcare and are at least able to afford it. So our vision is to improve the health and the lives of those covered by government programs. And our mission focuses on being a trusted partner, a low-cost leader, and a provider of high-quality, accessible care. And through our values, we focus on just emphasizing member-focused care, provider partnerships, community-based approaches, and operational excellence. So I get to be a part of the team that does a lot of the community-based stuff. And I will personally say that I really enjoy it, just being out there and being able to provide resources to our members. This is just a little overview of our footprint, kind of in all the places we are. In Nebraska, we just have Medicaid and Medicare, but we do have Marketplace in other states. So we currently cover about 21 states or so in the US. So here's just a brief overview of the things that we offer in Molina. So we offer focused care case management for members with complex needs, a comprehensive statewide provider network, a dedicated community outreach and engagement team, and we have the value-added benefits designed specifically for Nebraska. So just kind of how the other two plans have mentioned, we also have value-added benefits, we have healthy rewards, we have case management, and we'll dive into those throughout this presentation and we get to know a little more. So through our provider relations representatives, they are the main point of contact for our providers. So they build relationships through regular visits. They help with credentialing and keeping provider information up to date. And they also share important program and administrative updates. So we have a wonderful provider team that helps us with that. In addition to that, the provider relations representatives also help educate providers and resolve issues. They organize and attend provider events and state conferences. They monitor provider trends that affect quality of care. And then we also actually have a dedicated provider representative for our tribal nations. So that includes all the Indian Health Service, tribal and urban providers. Moving on to engagement, we believe that engagement is about access. So our outreach team, through outreach, we include like education, health fairs, partnerships, addressing social determinants of health, and referrals to case management. So I myself, as part of the outreach team, get to go out to various events. I get to either host events in partnerships with other organizations or host events at one of our offices here in Omaha. or I get to also attend events. So community organizations that are hosting events, we get to participate in those events as well and have a table with resources, provide some sort of service if needed, um, and just kind of fill those gaps that maybe if an organization needs help with something, we can sometimes help fill that gap, and just provide great services to the community. We do have a resource center in Midtown, so on 33rd and Harney. It's this wonderful little office space that has private rooms. So sometimes our case managers are able to meet with people one-on-one in those private rooms. We use them, members can use them as well, and actually anyone in the community. So not just members, anyone in the community can come out to this office and use, we have computers where people can use the internet to either apply for jobs, apply for Medicaid, do anything job related. We have, like I mentioned, those private rooms. We have an employment specialist that sometimes meets with people there to help them with a resume and just applying for jobs. We'll sometimes host events there. Last year we had a flu clinic where we were offering flu shots to anyone in the community that showed up to the event, and we had some resource tables from other organizations that came out to um, just participate in the event. And then we also have our wonderful front desk person, Shiloh. She is also very helpful with like value-added benefits and things like that. So if you were to go in person, she could help you with how to redeem those, helping you with that. Oh, and in addition, we recently added a access period cabinet at this resource center. So anyone in the community who needs period products can come into our office. It's free. You get a 3-month supply of period products. So you just come in, you tell them that you are looking for the access period products, and they will take you to the cabinet, and then you can take a bag with either tampons or pads, whichever you prefer. They do ask that you do like a little survey for access period. It's anonymous and you can answer as much or as little as you want, but it just kind of helps us figure out who we're serving and like the areas in need as well. So this is just more information about our resource center. We do have we have member advisory committee as well. So quarterly, we'll have meetings with our members. We'll invite them over. Usually we have one in person at the one stop, and then one virtual later in the day. So we always want to hear back from our members as well, and we want to make sure that what we're offering them is what they need. So each quarter we have a different topic. We send information out to our members for them to RSVP if they want to join us, and they can join us and then provide any feedback that they have. Here's just the address of it. Our community engagement email that you have on there, anyone can email that email if you have any questions about healthy rewards, upcoming events, or anything like that. You can email us at that email. That one's monitored daily as well. So we will either answer your question or we will forward your information to the appropriate person to answer that. And this slide is a little old. Kieran Scott is no longer our manager. Angeline Renfro is our manager. So if you want that email address, I can send it over to you. And just like the other two MCOs, we also have case management. So we our model delivers coordinated holistic care. So we like to link members to the type of case management that they need. So we can go from prevention and education to complex and intensive care. We also have case managers that are dedicated to disabilities, chronic illnesses, and long-term care needs. They can help with supporting like access to waivers and stuff like that. And we also have, for instance, case managers who focus on housing, and case managers who focus on employment as well. So whatever your needs are, I can put the case management email in the chat once I'm done. And you just if you have a member that needs case management, or you yourself are a member of Molina and need case management, you can email that email, and they will connect you with a person that you need. Here's an overview of our value-added benefits. So as previously mentioned, we no longer do actual cell phones. We do have SIM cards, so we offer that service as well. We do have a value-added benefit of $30 for personal care items. So every quarter through Nationwide's benefits, members get $30 to spend on personal care items. So that can be things like toothbrushes, toothpaste, toilet paper, and other things that you might need for the house. Every member gets it. If they don't use it, they lose it. So I usually encourage members to use it. It resets every 3 months. So if you log in and the balance says 0, it hasn't quite reset just yet. So you just kind of have to wait a little bit and log back in. We also offer a $30 gift card for kids to KiwiGo, which is an online store for books and art supplies. So any kid that's a member of Molina has access to that. Each household gets a $50 gift card for self-care and fitness items. So you can use it towards a gym membership if you want, or you can use it for some of those items listed there. So like a water bottle, resistant bands, jump ropes, things like that. For members with high-risk conditions, we do have access to home-delivered meals. I believe they usually have to be part of case management, so we can connect them with that. We also support with GED test fees and prep materials. And for our pregnant members, we do offer baby showers and virtual doula services. So any member that attends a Molina hosted baby shower gets a $60 gift card to use towards any baby items that they need. We also participate at other people's baby showers, so we don't just do like our own baby showers. We'll go to other community baby showers as well. And I believe we've actually co-hosted baby showers with the other two NCOs as well. So there's a lot of access to that. And anyone in the community can attend to the baby showers that are hosted by Molina. It's just that if they're Molina members, they get that additional incentive of the $60. We also have an annual pass for the Nebraska state parks. So any family, if there is a kid in the household, they have access to a Nebraska state park pass for the whole year. So they can call member services, and they can go online through their portal or through the app and request that, and we will send that as well. And we also offer transportation too, for medical stuff, but also non-medical things. So like grocery stores, food pantries, pharmacies, things like that. I believe we offer 10 round trips or 21 ways. And that is also set up. I have information on that in a slide coming up. Next we have our healthy rewards. So these are rewards for attending certain types of visits to their doctor. So this is just kind of a list. The only thing that's changed on here is the car seat. We no longer offer the car seat for completing the prenatal visit, but we do offer an $85 gift card for completing the prenatal visit. So parents can use that towards a car seat if they want, or towards something else baby related. But we no longer ship the car seats anymore. It's just an $85 gift card. But this is just various visits you can do. So there's the well child visits, at different ages, the annual wellness screenings, the health risk screener, if you do the glucose HbA1c screener as well. So these are benefits that we give our members for attending these visits. And like I mentioned this is our transportation. So any member can schedule rides to places like groceries, stores, WIC offices, anywhere. We use MTM for this service, and it is requiring that they schedule the rides at least 72 hours in advance. So I usually tell members that you can do that using the member portal, the MTM member portal, or they can call that phone number between 8 a.m. and 7 p.m. Monday through Friday to schedule those. We also have our Molina app and our member portal. So members can access their things, so like benefit information, ID card, medication list, anything that they might need through the member portal and the app. They can also redeem their value-added benefits through there, and I believe they're healthy rewards. So they can go online and attest to those and redeem those without having to call member services. But sometimes if you have questions or things like that, sometimes it's better to just call member services to get them done. But everything can be done online as well. This is just a brief overview of some of our covered benefits. So like you see here, we cover services like allergy and asthma care, medical equipment, immunizations, nutrition services, maternity care, physical exams, and there is no co-payments for office visits, urgent or emergency care, and pharmacy stuff. In terms of vision, for people under the age of 21, they can get an exam and lenses and frames every 12 months, but anyone over 21 and over can get exam lenses and frames every 24 months. And we partner with March Vision for this service. We also have behavioral health and wellness. So offer we include these services. It's not limited to this, but this is some of the services that we cover. Family therapists, therapy, 24/7 behavioral health crisis line, counseling, intensive outpatient day treatment, medication, and other things like that. And last but not least, dental care. So we offer routine dental exams and cleanings, fluoride treatments and dental sealants, x-rays, and as well as fillings and extractions, crowns, root canals, full or partial dentures, I believe, and braces as well. And if you have any questions, this is our AVP of Community Engagement, Kiana Brown. But I'll put my email in the chat as well. You can reach out to me directly. And I can either, if you need case management, I can help with referring you to case management, or if you have any questions about any of our other benefits, I can help with answering that as well.
Thank you. We just had one question come in, and I'm not sure who would like to take it, but there was a question on if one of you would be able to discuss briefly the EPSDT benefit.
I don't
The
know that.
periodic.
What was it again?
The EPSDT, the early periodic screening, diagnostics, and testing benefit for minors.
I'm not sure.